Hello everyone, my name is Matt Fellman and this is the continuation of my presentation regarding CPR. Now a few weeks ago I talked about CPR and a lot of the anatomy of the body when it comes to doing CPR, also known as cardiopulmonary resuscitation. I talked about the heart, I talked about the lungs, I talked about the brain, and what the functions are of when the heart stops, why we need to keep the brain alive, and whatnot. Today I'm talking more so about the functions of CPR. So today what I'll be covering is a brief recap of why CPR is conducted, talk briefly about what I did a few weeks ago, and I'll also be talking about compressions, ventilations, what that AED monitor thing is, that funny looking box you always see in hotel lobbies, things of that nature, and what to expect in the future presentation. So just to keep everyone engaged, I will be asking questions and things of that nature to keep everyone on their toes. So with that being said, I'm going to go ahead and kind of do a recap of what we talked about a few weeks ago. So, for one thing, as we talked about, the molecule of oxygen. It's absolutely vital, and it's that one thing we need in order to sustain life. Without oxygen, our cells die. With that being said, our brain, our human computer, which we talked about a few weeks ago, is absolutely vital and needs oxygen, and without oxygen, our cells die like everything else. However, our brain is not able to recover in a lot of situations. I think it's about 5 to 7 minutes without oxygen that our brain actually undergoes irreversible brain damage, and that's when you start to see individuals in that that sad vegetative state, and they come to the conclusion of they're in a hospital bed essentially for the rest of their lives. So with that being said, oxygen is absolutely paramount. CPR is essentially what we do when the heart quits functioning. So say somebody was to have a sudden heart attack and their heart quits working. That heart is no longer able to send blood, which contains oxygen to important cells within our body. We talked about the brain. So therefore, if the heart's not working, our oxygen in our head, our limbs aren't getting oxygen. So essentially what CPR does is allows us to keep those vital organs, i.e. the brain and the heart, alive until we're able to fix that heart or restart it, in best case scenario. So can anyone tell me, kind of in their own words, why we do compressions? Aaron.
We do compressions, I would say, for two reasons: to try to get blood circulating throughout the body, but also to try to increase blood pressure for when we shock the heart.
Yeah, great answer. In conjunction with having oxygen in our body, we're using those compressions to kind of send blood elsewhere. In a sense, you're almost functioning like a heart when you're doing compressions. So the idea of the heart is that it's a big muscle, kind of like my fist here, and the idea is that there's blood that fills inside the heart, and when it squeezes that muscle, it sends blood elsewhere, to our limbs, our brain, things of that nature. So here in the diagram you see somebody in the proper compression position for CPR. Their hands are over someone's chest where their heart's located, and they're pushing down. Here in the other figure here on the what would be your right side, you see somebody pushing down on the heart and then releasing up. So as I talked about earlier, say this is somebody's kind of a side view of somebody doing compressions, and this is someone's heart. Their heart's expanded. When they push down on someone's chest, their heart contracts, sending blood elsewhere. When they let up, they let blood refill in the heart, and just going back and forth between figure A and figure B, essentially. So like I said, it's kind of like you're functioning as a heart, because when someone's in cardiac arrest and their heart's no longer working, the heart's not able to pump blood anymore. Therefore, we're doing compressions to kind of function like that and act again. Next off, and the second of third components I want to talk about today, is that of ventilations. So I've talked about over and over and over again about how vital oxygen is for our body, our cells, to have in order to function properly. So with that being said, we ventilate in order to get oxygen into someone's body. Their heart's not working, their brain's not working, somebody isn't able to breathe when they're in cardiac arrest, therefore they're not able to get oxygen. We ventilate in order to supply that individual with oxygen. Here on the left side you see somebody with these handy pocket masks, and which they're out now because nowadays they're starting to go away from mouth-to-mouth ventilations because of germs and getting exposures back and forth. So now they're handing out a lot of pocket masks nowadays in order to kind of serve as that barrier. So you see an individual here doing mouth-to-mask and breathing, supplying an individual with oxygen. But in a best case scenario, you'll have what's called a bag malvasc, which is a giant bag in which you squeeze, sends air into an individual's body and supplies them with that oxygen that's so vital. So essentially, as a recap, ventilation is a way in which we utilize in order to get oxygen to someone's body, because when they're in cardiac arrest, they're not breathing. So The third component which I'm talking about today is that of that little computer you always see, the AED, or also known as a monitor. An AED or a monitor is used in CPR as a method to restart the heart. We say restart because what it's doing is that it's taking the electrical rhythm that's currently within a heart that's no longer beating, and it's going ahead and trying to shock the heart, stop it once again, and hopefully the cells within the heart will what's called repolarize and restart and go back to its normal effective method of pumping, and hopefully restart to begin pumping once again. What I talked about earlier, it's that computer that you oftentimes see in hallways, a lot of times in entrances. You're going to see them all over campus, public buildings, things of that nature. So a lot of times they're in these kind of compartments such as this, and they're in kind of a handy little pouch. Now years ago, or today I guess you might also see it in things like Grey's Anatomy, ER. You see people in these ER rooms, they have these great big paddles, and they get this gel and they load it up and they yell clear, and they go over one another and they shock the person goes flying 4 feet off the ground. That's what you used to see years ago, and that's actually a method that hasn't been used in several years, almost decades. Today, this is the same component, and this is what it looks like outside the box. So instead of those 2 giant paddles, they now use stickers. One sticker goes over one side of your chest, and the other sticker kind of goes on your side. And these stickers serve as that same purpose of sending electrical pathways within your body, hopefully to restart your heart. Kind of a little fact, kind of going over a little bit, but kind of a misconception within ER, shows like ER and Grey's Anatomy, is when somebody flatlines here on the bottom that you oftentimes see, when their line goes flat, people are a lot of times sending these electrical pathways, shocking them, defibrillating them, whatever you want to call it, when they're in these flat lines. In reality, that's not when these computers are actually sending shocks. They're sending it when there's different kinds of electrical pathways, such as what's known as ventricular fibrillation, ventricular tachycardia, and what it's doing is it's restarting that heart, stopping what rhythm's there, and going ahead and assuming that it'll hopefully regain that normal conduction that it's ordinarily in, such as what I'm in now, where my heart's effectively pumping, sending oxygen throughout my body. So just as a recap, compressions. It's something that individuals do during CPR to act as the heart, because our heart's no longer pumping. Ventilations is a method for us to supply the body with oxygen, because oxygen is absolutely vital for us to live. And lastly, the AED or the monitor is utilized to restart the heart. So those are the main 3 components of what I talked about today. And in the future, within my 25-minute presentation, you can expect me to go over aspects of bringing it all together, which you can see here in individuals doing compressions. Later on, they'll be adding on an AED monitor with those stickers, and somebody will be breathing for them. And then, of course, I'll be talking about examples, and then real-life steps and procedures. So, can anyone tell me kind of generally like what the first step would be? As far as you find somebody down, maybe CPR as a scenario, what would be your first general step? Yeah, go ahead, Aaron.
Check for a pulse, see if they're alive.
Yeah, checking for a pulse. That's absolutely great. Yeah, Dalton.
Call 911.
Calling 911. Yeah, so checking for a pulse, calling 911. JC?
And starting compressions.
Starting compressions. Yeah, those are all 3 of those things are aspects that we'll be talking about here in the next couple of weeks. So I'd love for you to kind of listen to this presentation and my previous presentation and before you start my 25-minute, but it's not absolutely vital, especially if you have experience in this field. So with that being said, there's no more questions. That's what I have here for you today. Feel free to contact me if you have anything else you want me to kind of re-talk about anything or make anything more clear. So, thank you.